Good morning, everyone. The committee will come to order. I want to welcome our witnesses to today's hearing. We are here today to discuss VA and what VA is doing, and if they're doing enough to support our survivor community. And then this topic is personal for me, as I guess it is to many of you, I'm sure. You know, I spent a lot of time whenever I was in the service watching my wife look closely I was part of 7th MAB and Max 7, and she was always known that if my 782 gear was gone from the front door, somebody might call her later, and we always had those worries. I understand the price of our surviving military family and community have to pay. It's a debt that Phil Rowe up here used to say could never be fully repaid, which is why I want to thank each of you for having the courage to join us here today. Just 1% of Americans raise their right hand and serve in our military, which means that less than 1% of American families will endure the pain that comes with the loss of their service member or veteran who they loved. We must ensure that our survivor community has access to the support, benefits, health care that their service member or veteran has earned, period. Whether it's a training accident, combat deployment, mental health struggles, or a disability as a result of the veteran's military service, it is the spouse and children who bear the brunt of these life-altering events. When a veteran is disabled because of their service, it is their spouses and children who have to support them. And when a veteran is totally disabled because of their service, it is their family members who typically serve as their primary caregivers. Military and veteran spouses often put their careers on hold to care for their loved one who bears the scars of their service. And when their veteran loved one passes away, surviving families often depend on VA pension or compensation to make ends meet. It is in that fog of grief that the survivors need to know that VA has their back. On January 5th, the Secretary stated that every day, VA will serve veterans' families, caregivers, and survivors, every bit as well as the veterans who served this nation. I don't doubt the Secretary's word. However, in multiple conversations with committee staff, VA employees described survivors' issues as less of a priority for the department than veterans' issues more broadly. Even the suggestion that that could be the case is unsettling. Too often, we hear the survivors are unaware of the benefits available to them or how to apply. The information on VA's website can be out of date for certain education benefits for survivors, but not for other benefits. We must ensure that VA is treating all education benefits equally. And let's say a surviving spouse or child does file a claim after wading through the confusing forms and conflicting information, then the VA often takes years to process their claim, whether it be for compensation, pension, or education benefits. Even a surviving child's simplest claim form, the DIC benefit, can take months to process. Further, in the ChampVA program, we have heard of outdated paper claim filing process, payments delays, and denials of health care services without explanation. And we've heard of VA vet centers turning away survivors seeking bereavement services and mental health support. These issues have real-life consequences for the families of those who have served. In 2008, Congress established VA's Office of Survivors Assistance to serve as a principal advisor to the Secretary on all policies and programs affecting the veteran survivors community. But under the Biden administration, this office was moved out of the Secretary's office and banished to the Veterans Benefits Administration within the Pension and Fiduciary Services. But the Pension and Fiduciary Services don't even cover all the survivors' benefits. Further, it has been easier for many survivors to receive DIC under the PACT Act, and I trust that 3 full-time employees within the Office of Survivors Assistance aren't able to handle the influx of questions and casework associated with these new authorities. Further, the Office of Survivor Assistance no longer even meets regularly with the VA Secretary's office. This is unacceptable. Unacceptable to me, and it should be unacceptable to all of us. And I look forward to hearing from Mr. Jacobs' response to my questions on it today. Furthermore, for the hearing, I specifically identified Deputy Secretary Tanya Bratcher, to be VA's lead witness. Deputy Secretary Bratcher should have been capable of answering the VA's what I see as a shortcoming in helping survivors. She could also directly answer why the Office of Survivors Assistance has been drastically deprioritized, and some would simply say ignored, by the Office of the Secretary. Now, I'm pleased that Undersecretary Jacobs is here, but in the future, I hope VA would send a witness that we had requested instead of substituting their judgment for mine. I'm proud co-sponsor of Representative Siscomonte's bill, the Prioritizing Veteran Survivors Act. This bill would rightfully return the Office of Survivor Assistance back to the Office of Secretary. This would ensure that all survivors' programs, policies always have a seat at the table and an advocate on their side at the VA. Now, finally, before we turn it over to Ranking Member for his opening remarks, I'd like to take a moment, if we could, a moment of silence. Kim Ruocco, who tragically passed away on January 21st. Kim was a surviving spouse of Marine Corps veteran John Ruocco and a vice president of suicide prevention and postvention at the Tragedy Assistance Program for Survivors. Kim was dedicated and an advocate for the entire survivors community. Kim passing is a great loss to them and us and to the entire military and veteran family community. With that, I'd like to take a moment of silence if we can, please. Thank you. And I now recognize Ranking Member Takano for his opening comments.
Well, thank you, Mr. Chairman. And in line of memorializing our deceased, recently deceased service members and veterans, I'd like to take a moment to honor the 3 reservists who were killed at Tower 22 in Jordan over the weekend. Sergeant William Jerome Rivers, 46, of Carrollton, Georgia. Specialist Kennedy Layden Sanders, 24, of Waycross, Georgia. Specialist Brianna Alexandra Moffitt, 23, of Savannah, Georgia. And in addition, several days ago, a couple weeks ago, we did lose 2 Navy SEALs who were lost at sea, Nathan Gage and Christopher Chambers. This is very sad news to all of us, and as we talk about survivors this morning, I'm thinking about their families who now join the ranks of hundreds of thousands of other survivors. So with that, let me just say thank you, Chairman Bost, for holding this very important hearing. 2 years ago, when the Disability Assistance and Memorial Affairs Subcommittee held a hearing on the topic of survivor benefits, it was the first time it had been discussed in a decade. So I appreciate that we are not waiting another decade again to hear from this vital community. Because what we found at that hearing 2 years ago was a survivors community, one that is at the core of VA's mission and in need of greater direct assistance. Historically, there has been a lack of resources dedicated to the mission of serving survivors. For example, only 2 employees in the Office of Survivors Assistance to serve over 400,000 survivors as of the 2022 hearing that I held. We also saw a lack of awareness of who and where the survivors community are, and a lack of direct and targeted outreach to them. As such, we have seen an underutilization of survivors' benefits. Since that subcommittee hearing, VA has made a few changes to increase their focus on survivors' issues. For example, VA has completed a long overdue motto change, adopting one that is more inclusive and that now directly mentions their duty to serve survivors. Moreover, VA has made the decision to move the oversight of OSA from the Office of Transition and Economic Development to the Pension and Fiduciary Service at the Veterans Benefits Administration, a move that should hopefully shine more light on the work that OSA is doing. They have also moved oversight of the Survivors Advisory Committee to the Veterans Health Administration, which is a bit more curious, but nevertheless will hopefully result in more visibility within VA to the committee's great work. However, I'm afraid, Mr. Chairman, that those changes so far have yet to produce substantial improvements to the programs utilized by survivors. And I suspect that we will also hear from our VSO and survivor witnesses that many of the same problems persist as they were 2 years ago. The move of OSA to P&F came with only a minimal bump in the staffing dedicated to it. Indeed, OSA has grown from a paltry 2 employees to a robust 3. And yet, the number of survivors that VA is tasked with serving has only grown larger in the wake of the PACT Act. So I am anxious to hear from VA how they plan to further staff that office so it can better serve survivors. And I'm also looking forward to hearing from VBA how they plan to better identify survivors and conduct more robust outreach to them. Currently, VBA only collects minimal demographic information on survivors. In fact, they cannot even query survivors' claims by cause of the veteran's death. VA must work to identify gaps in benefits utilization rates and conduct targeted outreach to disadvantaged or underserved populations. Additionally, sometimes survivors are only learning of the benefits available to them at the time of veterans' death. When family members are grieving the loss of a loved one, putting the onus on survivors to determine what benefits they're eligible for is truly a disservice. Grief's impact on those who lost a family member is debilitating and makes it difficult to find and often retain information. The survivor is just not in the state of mind to deal with all of this. That is why today, Mr. Chairman, I plan to introduce the Survivor Benefits Delivery Improvement Act, which will hopefully close some of these gaps in outreach and staffing and lead to better information in the hands of survivors before the time of need. Specifically, this bill will mandate the collection of demographic data from survivors receiving dependency and indemnity compensation, otherwise known as DIC, pensions under Chapter 15, and increased pensions for aid and attendance, with the goal of being able to improve outreach and equitable access to these benefits for the survivors of veterans. Collecting data on veterans, their families, and caregivers and survivors is an important component to understanding who VA serves and how to improve the delivery of services and benefits to these populations. This bill will mandate the collection of this data and will mandate also an analysis of any potential gaps in benefits utilization, and will direct VBA and NCA to create targeted outreach to underserved populations. NCA is the National Cemetery Administration. The second thing this bill does is to create a Survivor Solid Start program based on the successful Solid Start program to mandate OCA proactively to call survivors to discuss with them the benefits they have available to them. Additionally, the bill mandates that OCA have no fewer than 5 full-time employees to carry out this mission. And while this bill will not unfortunately address the myriad technical and bureaucratic difficulties survivors face when accessing benefits, nor will it address the inadequacy of the monetary value of those benefits, it will hopefully lead VA to dedicate more time and resources to serving this population. And that is why I'm also working with VSOs on sunsetting Chapter 35 as an educational benefit, and instead placing all veterans, survivors, and dependents under the same educational program. While well-intentioned, the Chapter 35 benefit lags far behind the Forever GI Bill benefit, and leaves survivors lacking benefits and oftentimes unable to get the specialized claims processing needed under Chapter 35. Survivors deserve a VA that is responsive to their needs, both before and after the death of their veteran. And it is my intent with the Survivor Benefits Delivery Improvement Act and our work on Chapter 35 to move VA further in that direction. Survivors have been underserved for too long, and they deserve this committee's attention and action. Today, we give them our attention, but like with so many other issues, this Congress has failed to deliver the action. So I invite you, Mr. Chairman, to join me in supporting the Survivor Benefits Delivery Improvement Act when I introduce it this afternoon, to help demonstrate to survivors beyond just words that they are a priority for this committee and this Congress. And I thank you, Mr. Chairman, and yield back.
Thank you, Ranking Member. I thank you for inviting me to join on to the bill. We did receive it last night. I found out about it this morning. I know many of our colleagues want to pass a bill before they find out what's in it. I prefer to read a bill before I find out whether I want to support or not. So we'll look it over and let you know back. But thank you very much, Ranking Member Takano. And we will now turn to our witnesses. Testifying before us today, we have the Honorable Joshua Jacobs, the Undersecretary of Benefits for Department of Veterans Affairs. We also welcome Dr. Mark Upton, the Department of Deputy to Undersecretary for Health, Veterans Health Administration. And finally, we have Mr. Kevin Friel, the Deputy Director of Pensions and Fiduciary Services at the Veterans Benefits Administration. Mr. Jacobs, you are recognized for 5 minutes for your opening remarks.
Chairman Bost, Ranking Member Takano, and members of the committee, thank you for the opportunity to appear before you today to discuss how VA is working to meet the unique needs of veteran and military survivors. Before I get started today, I want to join you in acknowledging a tremendous loss to the survivor community in the passing of Kim Ruako. She was a passionate advocate for suicide prevention and postvention, who transformed her grief into a lifelong commitment to supporting those who've been impacted by military and veteran suicide. Her legacy and body of work with TAPS will continue to inspire all of us for years to come. For our dedicated workforce at VA, our mission in caring for veterans and their survivors is deeply personal. In 1992, when Garrett Schmidt, a VBA employee of 16 years, was only 7 years old, his father, Sergeant Michael Schmidt, died in a plane crash with 7 other soldiers. Following Sergeant Schmidt's death, Garrett's beloved mother, Deanna, a daycare provider in rural Alaska, relied heavily upon VA's dependency and indemnity compensation benefits to care for Garrett and his 2-year-old brother, Preston. Bonnie Carroll, founder of TAPS, also lost her husband, Brigadier General Thomas Carroll, on that very same plane crash. And at the tender age of 9, Garrett collaborated with Bonnie to publish a book, enabling him to help other children of service members navigating their grief. Garrett also utilized dependent education benefits during college and said that the assistance he's received from VA over his life was crucial in maintaining stability during incredibly challenging times. And his legacy of service came full circle when he joined VA's pension and fiduciary service, where he works every day to help other survivors access their earned benefits. Stories like Garrett's inspire us to continuously try to do more and try to do better. After losing a loved one, survivors often face barriers accessing VA benefits due to intense grief, being disconnected from the military and veteran community, and because of difficulty navigating available resources. VA collaborates closely with the department's internal and external partners to reach survivors who may be eligible for benefits and care. Those benefits include the DIC and education benefits Garrett's family received, as well as home loan, survivor's pension, insurance benefits, healthcare coverage and bereavement services, and burial and memorial services. And as we continue improving the survivor experience, we're delivering more care and benefits to more survivors than ever before. To help meet the increasing demand for VA benefits, we've been aggressively expanding our workforce through hiring, including an 18% staff increase in the pension management centers. And in fiscal year 2023, we conducted outreach to approximately 300,000 survivors who may be eligible for benefits under the PACT Act, allowing us to deliver disability and indemnity compensation benefits to 45,000 new survivors, an 18.5% increase over the previous year. We delivered education benefits to more than 215,000 children or surviving spouses of a veteran through the Survivors and Dependents Educational Assistance Program, a 17.4% increase over FY22. We also offered more than 3,000 eligible surviving spouses favorable loan terms and assistance in purchasing, building, retaining, or improving their home through our VA home loan program. And ChampVA enrollees increased by 13% over FY22, where we paid nearly $2 billion in total ChampVA claims. And finally, the Veterans Legacy Memorial, the nation's first digital platform dedicated to honoring the memory of our fallen heroes, added 5 million new veterans to the platform this November, so that family members, friends, and the larger community can preserve the memory of these veterans and keep their legacy alive. Despite all of the success we've achieved in connecting more survivors with their earned benefits, we know that we still have plenty more work to do. Last spring, VA conducted a listening session with survivors to help us better understand the pain points, the moments that matter, and the opportunities to improve survivor support. During that session, we heard what many in this room know already, that far too many survivors still don't know what benefits they should be applying for, how to fill out their applications, or where to go to seek help or information. We recognize that, like veterans, not all survivors are the same, but there are a broad set of moments that matter, which is why we're continuing to do proactive outreach through events like the Survivors Forum we hosted jointly with DoD last week, and why we've launched a campaign to increase awareness about end-of-life benefits before veterans and their families reach their time of need. And it's also why we're using the Survivor's Journey Map behind me as a guide to plan for and design better experience for survivors. We're also improving internal alignment across VA to ensure communication and outreach with the survivor community is easy and accessible. When veterans, their families, and survivors come to one part of VA, there should be no wrong door. VA remains committed to the President's and Congress's goal of supporting survivors of our service members and veterans in a caring and compassionate manner that honors their sacrifice and service. And while we have made progress, there is plenty more to do. We look forward to partnering with this committee, with VSOs, with groups representing survivors, and with survivors themselves to continue tailoring our support to better meet survivors' needs. Thank you for holding this hearing and giving us the opportunity to talk about this important set of issues, and I look forward to your questions.
Thank you, Mr. Jacobs. We're now going to go to questions, and I will yield myself 5 minutes. Mr. Jacobs, there are survivors, services, and benefits beyond the pension and commissions compensation, including those provided by NCA and VHA. So why hasn't the Office of the Survivor's Assistant been moved from BBA's pension and fiduciary back to the Office of the VA Secretary?
Chairman, thank you very much for that question. Fundamentally, we have a form versus function debate. My goal in thinking about how we organize ourselves as a department is are we achieving the right outcomes? Are we delivering more benefits? Are we delivering a better experience? Are we increasing awareness? And so that's a major part of the reason why we're taking the Survivor's Journey Map that was built using direct feedback from survivors, and we're refreshing it to validate that what we heard before the pandemic remains true, or if not, that we update it. The other part, as we think about our organizational design, is thinking about resource allocation and making sure that as we design and locate offices, that we can optimize our return on investment for our customers. So we're taking a very hard look at our organizational structure, but the bottom line is those decisions will be predicated based on the feedback that we get through this updated research.
Also, the Office of Survivor's Assistant has 3 full-time employees. Yeah. When will VA provide that office with the necessary resources and personnel to assist all the survivors?
Yeah. So the one thing to note here, You're right. There are 3 individuals. We're looking to fill 2 open slots. But the responsibility for conducting outreach and engagement with survivors is not the responsibility of the Office of Survivors Assistance alone. We have the Pension and Management Center, where we have many employees who are responsible for delivering those benefits. Each of our regional offices are responsible for conducting targeted and specific outreach to their local communities. We have survivors on staff who help us do that because we know that not every survivor wants to be engaged in the same way or contacted whatsoever. So we need to do that smartly and respectfully, recognizing the various needs. And part of the way that we're doing that is taking this feedback that we've received to date, continuing to seek that feedback and figure out how we need to do better.
So the first 2 questions I've just asked, you can understand how this committee and others that are actually receiving benefits can see that the concern they have that the office is, 1, been moved away from the secretary, 2, is not being well staffed, which means that the problem is that those benefits which you're talking very well about, and you've got a good flow chart,
Yeah.
to the general public, not a good look. It looks like it's the kind of the stepchild, and I don't believe that's where we want to be. I don't think that was ever the intent. So on to the next side of the questions, though. Veteran surviving families are often unaware of what benefits are available to them and how to apply. So now what, through this flow chart and everything like that, actions are being actually taken to make sure that the survivors know in great detail what is available to them?
Yeah, no, thanks very much. Delivering care and benefits and support to survivors has been and will remain a top priority in the department. We hosted, as I mentioned in my opening statement, a survivors forum last week. When the Office of Survivors Assistance was located in the Secretary previously, we would have somewhere along the lines of 50 participants. Now, under the reorganization, we built that up to 200 last week. We clearly have more work to do. There are about 600,000 survivors that we serve every day. So there is a gap in knowledge and awareness and our ability to connect. Part of the way that we're doing that is through this work. We're working on targeted outreach. So I mentioned the end-of-life information. We are collaborating with VHA, NCA, and VBA to get information out about the suite of benefits that are available to survivors, to talk to them about the end-of-life choices that they're going to have to make with respect to their health care, to make sure that they can plan in advance for burial and memorial needs. The other thing that I'll say that's really important for survivors is over the last year, I've traveled across the country trying to increase utilization of benefits. And one of the most common refrains I get when I talk to veterans is, I don't want to apply for benefits. I don't want to take away benefits from someone else. And every time I hear that, I always refute it because you're not taking away benefits from someone else. You're helping yourself, you're helping your fellow veterans. But one of the things that's most persuasive when I talk to veterans is, don't do it for yourself, do it for your family member. Because when you are no longer here, these benefits can help your family long after you have moved on.
My time's expired, but I'm going to ask right quick. When did you schedule the forum, before or after having this meeting scheduled?
This is an annual forum that's planned well in advance. I don't know the exact date, I could give it to you, but we hold it every year.
All right. Ranking member, you're recognized.
Thank you, Mr. Chairman. Undersecretary Jacobs, I'm less concerned about where OSA is situated than I'm about its operation. And as I spoke earlier about the current staffing level at OSA, I do feel it's inadequate. I share the chairman's concern that the Office of Caregiver Support has over 500 full-time employees to support approximately 40,000 VA caregivers. And I realize there may be some balance of complexity here, but 500 full-time employees to serve 40,000 VA caregivers. And I don't know how VBA thinks that 3 employees are sufficient to staff the Office of Survivor Assistance, who are supporting nearly 500,000 survivors. That the public doesn't understand that, this committee does not understand that. And I know that the chairman answered this question, and you did announce a plan. I do hope you do have a plan, but I want to move on to another question, if I may. Well, you want to respond? Go ahead.
Yeah, I just want to say, so we have hundreds, and I don't know the exact number, at the Pension Management Center of staff who are responsible for nothing other than dealing with survivors' benefits. That's DIC claims, survivor pension, burial benefits. Our call center employees manage a lot of that. They got over 750,000 calls in fiscal year 23. So yes, we have many more employees than in our OSA. That said, we are working to validate that our staffing structure.
I just want to clarify, the call center employees are under a time limit, right?
Yep.
When they call in, they're not really equipped to sort of deal with maybe an aging survivor who may not be able to ask their questions in a succinct manner. And they feel a lot of pressure to kind of move them around. And so citing that you have a lot of call center employees doesn't really kind of get at those people with the expertise to really answer questions, right?
Yeah, and I don't want to leave you with the impression that I'm satisfied, because I think we still have more work to do, and we're constantly looking how to improve. I just wanted to provide context that there are more staff focused on survivors than just those that exist in the Office of Survivors.
Well, it would be helpful to me to know just how calls get routed. And
Sure.
I mean, what I'm hearing from survivors is that they would like a one-stop shop.
Yep.
I don't think VA currently provides that. And
You're right.
you're not in the state of mind to be able to be clear. And we need to get to people on the front end. So the loss of a loved one has been associated with depression, anxiety, substance use, and prolonged grief reactions. And so it is vital that when a survivor interacts with the VA, they're treated with kindness, compassion, and patience. And yet, we've heard that the VA call center employees feel like they must rush important calls, including the first notice of death calls. Mr. Jacobs, why was the decision made in 2020 to route survivor calls to call centers versus one specialized center?
Yeah, so I can't tell you. I'll have to get back. I'll have to get you an answer for the record there. What I'll tell you is, in looking at the customer experience data that we have, the customer experience data for survivors is actually better than the general population of callers. But at the same time, I just had a conversation last week, and I'm hearing anecdotal information about survivors not getting the information that they need in a timely, accurate, and respectful way. So I've asked my team to meet with TAPS and other groups to dig into this to make sure that we can talk through these issues.
Well, did VA conduct any research that determined that a single call center was insufficient or unsatisfactory? Have you kind of looked into that?
So what I'll tell you is, with the updated research that we are working through on the survivor journey map, we are identifying a desire for a single point of contact. We're working through to figure out what that actually means. I've got some preliminary information that I just received. We're looking to finish this up in the next few months, and then I'd be happy to follow up.
So you are monitoring, my question is, what monitoring has occurred since then to validate that choice? I mean, are you guys monitoring the situation?
Yeah, very, very closely. What we're seeing is that the data is telling us one thing. The anecdotal information we're hearing is telling us another. So we've got more work to do to get this right.
Okay, my final question has to do with, we're hearing reports from advocates that there tend to be errors and delays for beneficiaries attempting to use Chapter 35 or the FRI scholarship if they also have GI Bill eligibility from serving themselves, or if it was transferred to them from a parent because of the individual having multiple files in VA systems. Obviously, the confusion and delays can be extremely frustrating. Should VA move to a specialized group of claims processors to handle claims for Chapter 35 and FRI scholarship beneficiaries, which would reduce errors?
Yeah, Congressman, I would ask that if you have specific cases that you share them with me so I can look into them, and I'd like to follow up and provide you a more informed answer. I'm open to it, but I'd like to better understand the issues that you're referring to.
Well, thank you. Mr. Chairman, I yield back.
Dr. Miller-Meigs.
Thank you, Mr. Chairman, and thank our witnesses for being here. Dr. Upton, what steps are currently being taken to modernize ChampVA's claim filing system to prevent substantial delays in processing claims?
Thank you, Congresswoman. As you know, ChampVA is a very important part of our commitment in VHA to honoring our family members, survivors, and caregivers. As this program has expanded, it's clearly shown us the need that we need to modernize based on feedback from the beneficiaries who use the system. To answer your direct question, we've heard very clearly that the process of submitting applications for eligibility is done solely in paper right now and requires time and reviews to process, as well as beneficiaries, when they submit claims directly, those have to come in paper as well. By the end of this calendar year, we are aiming to have an online form available for submission for eligibility as well as claim submission. We're also working extensively on modernization of the whole enrollment and eligibility process, and we'll certainly keep you updated.
Thank you. How is the VA addressing the issue of, as a provider, the issue of prolonged payment delays to community providers under ChampVA, and what measures are in place to expedite these payments?
Sure. Thank you. Yes, in order to manage this program and serve that commitment to the beneficiaries we serve, we have to be able to pay providers timely. It's something that's critical in order for providers to be open to see our patients, as well as for beneficiaries not to receive bills. What we've done in the ChampVA program is work to modernize how we process those healthcare claims from providers. Instead of having a human have to touch and review every claim, we're now auto-adjudicating 92% or more of claims that come to us electronically from providers, paying most of those within 30 days, often within 7. But we know there's more work to do, and continually want to reach out to our provider community to make sure we're paying timely and their questions are answered.
So if you're auto-adjudicating or using AI to determine claims, can you also keep us updated on the percentage of denials?
I'd be happy to update you on the denials.
Okay. And given your answer to the first question about moving from paper applications to an online form, can the VA provide data on the average time frame for resolving backlogged payments and applications, and the steps taken to prevent, I think you've already mentioned, to prevent such backlogs, so that you can track before implementation and then after implementation?
Absolutely. We will track that, and it's very important for transparency to you and those we serve.
So then we can follow up next year or the year after.
Absolutely.
Regarding the wrongful denials of necessary healthcare services, what's the VA's process for reevaluation of denials and recertification of such cases, and how can this process be made more transparent and accountable?
Sure. For the bulk of ChampVA care, as opposed to other programs we run that provide care in the community, ChampVA typically does not require pre-authorization or pre-approval from VA. But in instances where there is a denial or there is a payment that provider feels that should have been made, we have a contact center with representatives that can work with providers and beneficiaries. What we've noted as we work to modernize this system is that the beneficiaries that use this system could benefit from further coordination for their care with providers, especially in higher sensitivity or high risk types of care. So we are working on better coordination and putting a team in place that can help as the next phase of maturity in the system.
And you may have already answered this question, but very briefly, how does the VA plan to address the systemic administrative issues within ChampVA to improve overall integrity of the program and better serve one of the most vulnerable segments within the military community?
Very important, and it's one that we want to do systemically from the start of beneficiaries learning about the program, from the enrollment process through the payment, as you mentioned, and through the data we talked about earlier, as well as other steps. We're committed to transparency, listening to our beneficiaries, and working with this committee to make sure that you see what we see and we get it right.
And then, Honorable Jacobs, in response to one of your answers to a previous question, you had mentioned that to Ranking Member Takano that the information you're receiving, perhaps, and you're going to meet with TAPS or other organizations, that your responses have been very favorable, but you're hearing something different. So have you thought about doing a follow-up survey after people have reached out, and then looking at the follow-up survey to see if, in fact, and it could be randomized, done, to see if, in fact, your services are reaching those or your outreach is beneficial?
We are, and we're looking at it both from a qualitative and a quantitative perspective, because when you get quantitative surveys, you often are limited in terms of what you can glean, but when you actually talk to individuals, you get a much richer perspective. And so that's what this, the Survivor Experience project is all about, and it's why I've asked my team to follow up, and I'll be part of some of these conversations as well with organizations representing survivors.
Thank you, and I yield back.
Congressman DeLuzio, you're recognized for 5 minutes.
Mr. Chairman, thank you, and good morning, everyone. Undersecretary Jacobs, I wanted to come back to something you had said, I think, in your remarks or questions with the chairman or ranking member about veterans being hesitant, perhaps, to apply for benefits. And I just want to make very clear, and I suspect you agree, any veterans who is eligible, or survivor or family, those are earned benefits and should not be shy about pursuing them and applying for them. So thank you for reinforcing that message. I want to focus on pension poaching. As I understand, and the scams can take many forms, typically some version of an unethical advisor or attorney or someone presents themselves to a veteran or family and distorts their records or distorts what they submit to VA, might take out some fees in the process. That blows back eventually on the claimant, the veteran, their survivor, their family. Give me a sense, what do these scams look like? How are they presented to the typical veteran or their family who's applying?
Thanks very much. I'm going to turn it over to Kevin in just a moment to speak to the details, but we are very concerned about pension poachers and the increase of fraudulent and predatory activity that's targeting veterans and their families. It's one of the reasons why we started the V-Safe effort, and there's a broader interagency effort to prevent and respond in cases where there is predatory behavior. But let me turn it over to Kevin to speak to some of the details.
Yes, sir. As you stated, the predatory action is that they tell a veteran or a beneficiary that they would be entitled to veterans pension or survivors pension, and that they could get them at the aid and attendance rate. And then what they would do is they would appoint or assign someone to be their in-home care attendant and, you know, charge them for it, but they would give them an upfront loan so they could actually pay for it, so that they could count that as a continuous medical expense for VA purposes. And then upon submission to the application, when they get a retroactive payment, they assume some of their retroactive payment to reimburse cost. You know, they wouldn't charge them for doctor's visits, but then would add that on in the back end. We've taken some actions within our space. On our form, it's annotated that you cannot be charged to file for a VA claim. Initial VA claim. We've also put notifications on our website that identify about pension poaching and reporting them. We've worked with the Department of Justice, their Elderly Justice Committee, and to bring that to light and to take actions there. So there's a lot of ongoing behind-the-scenes action, but it's typically we don't find out until after it's happened, which is one of our burdens.
So I think of two big buckets of response. One is outreach and education for veterans and their families and survivors to understand the risks, to be able to detect if this is happening, so they don't fall prey and they aren't hurt. There's also an enforcement part of this. And so you mentioned the Justice Department. What does that look like? How are you working with DOJ? What other authorities, if any, does the Congress need to provide? Because I think we can't just have the burden here fall on veterans and their families. When we have bad actors, we should go after them.
So at our work with the DOJ, it's actually an enterprise stood up with the DOJ where it has numerous federal agencies, and it addresses issues related to elder abuse and taking advantage of elderly people. So there's actually no actions that we can take out of that, legal. But we are also restricted, and we've had conversation with our Office of General Counsel. We are restricted in what we can do, outside of a potential cease and desist, but we have no authority to support that. So, Mr. Dick.
And I would love to follow up with you directly about opportunities for us to more proactively respond to the scourge of pension poachers.
Are there specific components within the Justice Department that are liaising with VA on this issue?
I'd have to take that back to get you who's all involved with that.
Yeah.
Please do.
Yeah, more broadly, we are working with the Consumer Financial Protection Bureau, with the Federal Trade Commission, with parts of DOJ, and we'll get back to you on the specific elements for a kind of a whole of government effort to tackle predatory actors in this space.
Very good. Mr. Chairman, I yield back. Thank you.
Representative Self, you're recognized for 5 minutes.
Thank you, Mr. Chairman. Before we can fix anything, we need to figure out why. You've got 27% backlog claims under the PACT Act. I understand from our last hearing that you're planning on now peaking at 600,000. And then you've got the 10 oldest survivor claims have been going on for 4 to 5 years. So can you talk to us about the why of both of these cases?
Yeah, we have identified, some of the oldest claims, and each of those cases are unique. The bottom line is it's a priority to fix them, but there are a variety of solutions to each of those cases. Some of the reasons behind the timelines that you mentioned are they range from trying to address claims that were impacted by the fire and need to be fixed to
You're talking about the 1973
the 1973 fire where
Really?
Yeah. There are issues where we're trying to pull together the rest of the record. There are issues associated with custody and in some cases involving homicide or murder and working through kind of.
So what have you done to, now that we know you've got 10 claims that are more than 4 years old, what are you doing today to get them adjudicated?
So what I've asked my team to do is to personally reach out to the 10 oldest claimants and figure out what we can do. They're all different. Some of the issues we're waiting for information. Some of it is, in some cases we've identified information that was missed in an earlier review of the claim, and so we're backdating the effective date to give the most potential benefit. And so it's just a matter of handling them with a case management approach and with a sense of urgency.
I would like a detailed report on that, if you don't mind.
Happy to.
I understand that VSOs file up to 90% of actual claims. What part do the VSOs play in education and filing survivors' claims or helping you with them? Because it looks to me like VSOs are a critical part of initial claims. Are you using the VSOs to their full potential in survivors' benefits claims?
Yeah, so accredited representatives like VSOs are critical partners in helping us increase awareness and provide that connective tissue to help submit claims on behalf of both veterans and survivors. What I would tell you is I think we need to be doing a whole lot more. There's a knowledge gap that exists within the survivor community. In some parts, it's because they may have been disconnected from the military and veteran community. They don't know about these benefits. They didn't serve themselves. And so we've got a responsibility, a moral responsibility to do a better job of proactively and effectively reaching out to them.
And I think the VSOs could help you with that.
Absolutely.
Because they're locally
Yes, sir.
known. Lastly, I met with Jason Cave last week, and we were talking about folks getting into the system, and I said, what is the single, and I'm talking about your single point of contact now that you mentioned earlier. I'm not sure that's a good idea, because I said, what is the number and where does it go when someone calls the Dallas Vision? And he said, oh, there are probably 15 numbers out there.
Yeah.
I'm not sure a single point of contact is the best way to go. Why would we not have a plethora of avenues into the system?
Well, we do want, we want to make sure that there is no wrong door. But I do think one of the things we're hearing from survivors is that they want a compassionate single point of contact to help them navigate through this. This is where our survivor experience effort is going to help us make sure that we're listening to the needs of survivors. We have the call center, the National VA Call Center, 1-800-MY-VA-411, that allows calls to come in and then be moved to the appropriate business unit. We have regional offices, we have medical centers, we have cemeteries. All of those opportunities, all of those entry points should enable the survivor to connect with his or her benefits. But you're right, it's more complicated and more nuanced than that.
It's far more complicated, and a single point of contact is a single point of failure. I yield back, Mr. Chairman.
Representative Brownlee.
Thank you, Mr. Chairman. I wanted to talk a little bit more about ChampVA. I've introduced legislation that would bring the age limit up to 26. That was set by the provisions of the Affordable Care Act. This is important, obviously, to survivors, particularly for surviving children who aren't going to college. So what would the VA need to be able to handle this increase in care recipients? My understanding is that there is a cost, certainly, but not an astronomical cost. So I want to know why the VA really hasn't tried to move on this.
Sure, thank you, Congresswoman. And supporting the dependents who use ChampVA is so important to us. Right now, children or dependents 23 and under account for about 176,000 of our total enrollees in ChampVA. And as you mentioned, currently ChampVA will cover dependents up to age 18 or through age 23 if they're a full-time student, but not age 26, as with many other health plans through the Affordable Care Act.
That's what my bill says. Yes, I'm very familiar.
Yep, and from our perspective, it would require legislative change, as I know you're aware, Congresswoman, and resources, as you mentioned, but we would be very happy, I would personally be happy to work with you in the committee on steps to better align us with the Affordable Care Act and that age 26.
Very good. I will follow up with you on that. I also wanted to ask, with regards to the letter that survivors receive, the VA summary of the benefits that is in that letter does not provide an itemized list of compensation that a survivor is receiving. So survivors only see a lump sum of the DIC payment, and this, I believe, limits their ability to understand if they're receiving all the benefits for which they are eligible and or when benefits might end. Why doesn't the VA provide an itemized list? VSOs have been asking this for years.
I think it's a great idea. It's actually something that we were talking about earlier this morning, specifically about this. And this is where that human-centered design research is going to be really important for us. I think there's benefit. I think what we just have to do is to kind of explore the feasibility and kind of what steps have to be taken. I think inserting additional complexity, it always creates risk, but those are risks that we can manage and execute towards. I think increasing the utilization and the utility of the information we're sharing is important. So they know if their if a survivor's beneficiary ages out of the program and is no longer eligible, they understand why the level of compensation may change. I think that's really important. The bottom line is we need to do a better job of listening to survivors. That's what this survivor experience effort is intended to address, and it's issues like this, as well as tackling things like our forms, right? We know that the plethora of benefits that we provide are wonderful, but there are varying eligibility requirements. Anyone who's dealt with a government form knows how frustrating it can be. So we need to figure out how can we simplify, how can we streamline, how can we do everything we can to make it easier to apply for and access these benefits while maintaining our requirements under law.
Well, it seems pretty simple to me that the VA, in order to write this letter to survivors, they have to come up with an itemized list, add it all together, and that's the lump sum of what you're sharing with the recipient. So I don't understand why it's complicated to just put down the itemized benefits.
I think in some cases we're dealing with antiquated legacy systems that make what should be a simple, easy to do task more complicated and challenging than it otherwise would make sense. I'd be happy to follow up with you personally to talk about that along with our IT partners. The bottom line is I'm committed to doing this. We just have to figure out how to best do that.
Okay. I hope it happens sooner versus later. You mentioned the forms that one must fill out. So I wanted to ask you why the DIC form is 20 pages long. What is it in that form that requires 20 pages? Correct me if I'm wrong, but my understanding is it's 20 pages long. And what is it in that form that you need in order to secure the benefits that requires 20 pages?
So, Congresswoman, I would tell you I share your frustration, and I don't think it's acceptable. That's why we're actively working to meet with groups to talk through how we can streamline it. But let me turn it over to Kevin to talk through some of the specifics that are in the form and how we're thinking about tackling that.
Yes, Congresswoman. One of the issues with the length of the DIC form is that is actually an application for DIC, survivor's pension, and accrued benefits. By law, and a claim for DIC is a claim for all those benefits. So we have to try to collect as much information as needed within that form to make an informed decision. We are looking at opportunities. We have a regulation that we're considering to see if we can streamline it somewhat. But to your point, yes, ma'am, we all agree that it's long. We just have to come up with a way that within the law, within the structure of the law, to be able to streamline it to make sure we get all the required information.
I hope you'll continue to work on that. Thank you, Mr. Chairman, and I yield back.
Representative Franklin.
Thank you, Mr. Chairman, and thank you, gentlemen, for your time with us here today. We obviously know how important this is. I appreciate all the work you all are doing. The reason we have these oversight hearings is how can we assess how we're doing, take a kind of a snapshot, and how can we get better. So I hope you take everything you get from us here today in that spirit, and it's all about the veterans and how we can make things better. Mr. Jacobs, you had you referenced earlier that there are a number of ways that people like to be communicated with. Some don't want to be called at all. I know as far as making survivors aware of the benefits that are available to them. There's an online survivors toolkit, I guess. There's a form letter that's sent out. How else do you communicate with them? Is there anyone that actually makes active phone calls to the people you have in your database?
In some cases, so I was up in our Providence regional office, and we have a Gold Star mother up there who works for the VA regional office, and she actively engages with the survivor community. And we have employees who have lost loved ones and are now dedicating their lives to helping others behind them. And so, yes, we have we have employees who actively engage with survivors communities. We work through our partners.
But that's anecdotal, though. I mean, some are doing that, but that's not part of the process.
It's part of the process. I mean, we do. I think we need to do it more and more consistently. I would also say we work with with the groups like TAPS to try to get information out. It's why we hold survivors forums. We don't have the solid start idea, so the idea that I think Congressman Takano was mentioning, this idea, it's something, I think it's a very interesting idea. Want to look at the resource requirements and how you might effectuate that and how that might lay up against other ideas. But the bottom line is I think we need to do more. And we need to do more because there still remains an incredible information gap and an awareness gap amongst too many survivors.
So that leads to another question I have. Is there any sense, is there any measurement, any way to quantify the number of people who are eligible for benefits that just that you don't connect with? Either because they're not proactive or they've fallen through the cracks, but do you have any sense of, you got to know potentially what your exposure is, how many people could we be helping and how many are we?
So we currently are surveying about 600,000 survivors right now, give or take. The challenge for us is that,
Well, how big is the pool of who could and should be helped?
Do you know the number there?
No.
Yeah. So I was going to say, the challenge for us is understanding that is difficult. So when a service member passes away while in the military and those services know who has died. In our case, if we don't have that control and command, so we don't have that same visibility. This is where I think creative ideas like working directly with funeral homes and finding other ways to capture that information is going to be important because we have limited visibility on the total population, the total potential population.
Okay. We only have a little bit of time here, but we've heard about some significant delays in discontinuing DIC when a spouse remarries or when a child turns 18. How can we address these better to avoid these clawback situations where people are overpaid benefits and then suddenly, sometimes long after the fact, they're told that they've got to come up with a lot of money that they didn't know they were receiving incorrectly? To me, it puts an unfair burden on folks because of administrative delays within the VA.
Yeah, I think it's really important. We're trying to do everything we can to minimize overpayments and reduce the debts that are created as a result. Let me turn it over to Kevin to talk to some of the specific steps that we're taking.
Yes, so one part is it'll play a very important role in this will be the Cleveland-Dole Act, which will limit how long VA can work a claim or have a claim where the debt continues to accumulate. We're working on the implementation of that, and that will help reduce the overpayment if it takes us VA
So can you detail that a little bit more?
Yes.
Is there a cap then on how much some could be clawed back, or is there a time limit on how long those can accrue before they're expected to?
So that's what we're targeting is a time limit on how long a claim can continue to accrue a debt once VA has it in its possession, once VA knew or should have known about it. That's one of, part of the debt comes with the timeliness of notification, how long it takes someone to let us know that they have divorced or they are remarried, and then within our claims process is the other side of it. So the Cleveland-Dole Act, once we get the implementation piece, it will restrict how long VA can continue to accrue debt on an individual based on our timeliness.
And so we're working to make those definitions right now through, we're working on regulations that would provide that timeliness.
Is there a timeline you're looking to have that settled by?
I think in this calendar year, we have draft instructions that allow us to kind of do it for a year, kind of cap it at a year. But we're looking at kind of a program-by-program approach. That was done so we could utilize that authority immediately. We're taking a much closer look right now for the regulation.
Okay. Thanks, Mr. Chairman. I yield back.
Representative Budzinski. Thank you, Mr. Chairman. I was hoping to ask the VA today about just some concerns I have for survivors as far as support for affordable housing in particular. So when a veteran passes away, that surviving partner then immediately is incurring obviously the cost of mortgages and rents and utilities, and how that might be contributing to an increase in homelessness for surviving partners. And so I point out the dependency and indemnity compensation benefit is limited to 43% of what a survivor's disability compensation would be. And survivors may have to wait upwards of 4 months to receive those benefits, obviously further exacerbating this concern and issue around affordable housing. I really feel like we need to be doing more to address this for surviving partners. And so my question is for Mr. Jacobs. What does the VA currently do to help veterans financially prepare for the income change to their family when they pass away? And where might the VA be able to do a better job to prepare the families for that change?
Thanks very much for that question, and you're right about the kind of the level of support. I think one of the things that we're trying to do is get information out well in advance of a veteran's family time of need. And so one of the challenges is trying to navigate benefits like housing and income change in the immediate aftermath of a loved one's passing, dealing with an overwhelming amount of grief, trying to take care of children, trying to take care of the immediate affairs. And so we do have benefits associated with the Home Loan Guarantee Program where we can help survivors. I think we helped about 3,000 surviving spouses last year, but I think there's a lack of awareness that program exists. It provides competitive finance rates for surviving spouses, but we need to get more because our tools are somewhat limited in that space. That's why we're doing this proactive outreach regarding end-of-life benefits to make sure that all of the suite of services are available and understood before the time of need.
Could you maybe further elaborate that on maybe what the VA has seen with these surviving spouses, just like statistics around the financial impact of what it means immediately after a veteran were to pass away? Just, statistics, I guess, that you've observed from surviving partners.
Yeah, so I'll have to come back to you with more statistics on the specific the specific details. But what I would say is what we've heard from individual survivors is just the incredible stress. Mm-hmm. There's a lack of awareness. There's confusion about what benefits they may be eligible for, how to access those benefits, whether they're even eligible in the first place. So I think we're starting at a deficit. They're dealing with an incredible amount of grief. And on top of that, trying to navigate a system that's entirely too complex. Mm-hmm. We've got we've got this survivor's journey map. Some of the things we see is, becoming aware of benefits, just being informed it's table stakes. It should be basic, but it's not something we can take for granted because far too many people just don't know.
Right. And is there something that VSOs and MSOs can be doing additionally, in your opinion, to assist?
Yeah. So one of the things, we always share our information about benefits, about how to access those benefits with our VSO, MSO colleagues. Continuing to get the word out is really, really important. One of the things we find, so for example, in our transition assistance program classes, our transitioning service members are going through a life-changing experience, leaving the military. They're being asked to absorb a day's worth of information about all VA benefits. It helps to have a family member there. And so just as we're trying to get words with our partners in the VSOs to those veterans, trying to include families is really important because oftentimes the veteran himself or herself may know about the benefits, but his or her loved one may not.
Okay, great. Thank you. I yield back, Mr. Chairman.
Thank you, Representative Van Orden.
Thank you, Mr. Chairman. I got to say something real quick, Mr. Jacobs, in reference to Ms. Brownlee's question where you said that there's some legacy systems that are impeding your ability to contact people. You can literally buy a Commodore 64 and have dial-up internet to send an email. So that is a horrible excuse. I have a list of 16 different VSOs here: Air Force Association, American Legion, Vets Association, United States Army, Disabled Veterans of America, Enlisted Association of the National Guard, Gold Star Wives of America, Iraq and Afghanistan Veterans of America, Jewish War Veterans of America, National Guard Association of the United States, National Organization of Veterans Advocates, Paralyzed Veterans of America, Tragedy Assistance Program for Survivors, Vietnam Veterans of America, the VFW Wounded Warrior Project. If you add the county veteran service officers in there, there's 17.
Yes, sir.
How much federal funding do these guys get?
I'm guessing none.
There are very rare instances where they get money.
Yeah.
All right, check me out, man. You have a $3.9 billion operational budget, and you have 25,000 employees. If I took half of your operational budget, which would be $1.95 billion, and I divided that by the 3,069 counties in the entire nation, we could put 9 GS-12s in every single county of the entire nation. So I don't know why you have all this money if you're depending on these people to do the preponderance of your work.
Sir, first of all, let me try to clarify what I said earlier. I'm not making excuses.
I get it. Hey, no, I get it.
Listen,
I've heard you say that 1,000 times, so let's cut to the quick, pal. My question to you is, would you support federal funding for these VSOs?
I'd be happy to talk to you about that. I say we rely very heavily on them, and
Yes, you do.
talking through the
You rely very heavily on them. I don't know how heavily you rely on the 25,000 employees that you're responsible for. Let me ask you a real simple question. How much did it cost to produce that survivor's journey map, that chart, that fancy looking awesome thing that nobody can read? How much did it cost to produce that? Man hours, salaries, retirements, conferences, printing costs?
Sir, I'd be happy to provide that to you. What I would tell you is we're delivering more benefits to more survivors. We had an 18.5% increase in the number of new DIC survivors benefits that we delivered last year. We delivered 17.5% more dependent educational assistance benefits.
Sir, I read your written testimony in detail, and it is lacking. Because you have, again, a $3.9 billion operational budget. You employ 25,000 people, and you still depend on these volunteer organizations that are funded by our membership costs. And that is completely and wholly inexcusable. This is a failure of the grandest proportion. And for you to come here and blow off my colleagues, Democrat and Republican, by these gobbledygook answers that mean absolutely nothing or silly. Check this out. Pepin County, Wisconsin, 7,318 people are there. There's a veterans population of 549. They're only able to afford one part-time veteran service officer because they get $550 from the state of Wisconsin. Okay, that's unacceptable. We take half your budget. There's 9 full-time GS-12s working in Pepin County. And to me, that is a judicious expenditure of taxpayers' dollars. Your department is not. So I'm going to ask you again, would you support funding these CVSOs with federal money?
I'd be happy to talk to you about working.
That's not an answer.
Sir,
I have 1 minute and 10 seconds left. Just say yes or no.
Sir, I would be happy to.
You don't know. Okay, here's what I want from you. Please write this down. I want a detailed troop to task. Do you know what that means? I want to know what these 25,000 people are doing every day. I want to know what they are doing. I want your travel budget to include your hotels, air, rent-a-cars, per diem, and the budget for all these conferences that you hold. And I want an itemized list of all those things, because you are absolutely blowing money in a way that is not commiserate with helping our veterans in the most efficient manner. You cannot argue that.
Sir,
because you've said that 50 times today. We need more. We need to do better. Better, 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 better.
Sir, I would have to respectfully disagree.
Okay, respectfully disagree, but what I just stated was a fact.
For the last 3 years in a row, we have delivered more benefits to more veterans and survivors than ever before.
And then why did you say that you have to do better 1,000 times? I can pull your testimony because it's recorded.
We wake up every day, and the most dangerous words in any large organization is, that's the way it's always been done. We're not accepting that as an answer.
I understand
What
that.
we've identified is there is an
Sir,
unmet need
my
among
time has
survivors.
expired. I want the answers to those questions that I gave to you because I chair the subcommittee that's responsible for the transition assistance program and for these educational benefits. And you will be in front of my subcommittee answering these questions. Is that clear, sir?
Yes, sir.
Thank you very much. I yield back.
Representative Landsman.
Thank you, Mr. Chair, and thank you, Mr. Jacobs, your team for being here and all the work that you do on behalf of veterans and survivors. Just trying to be as helpful as possible to folks back home. If you were a constituent of any of ours and you were setting out to determine what benefits you might be eligible for as a survivor, what would you do? This is not a gotcha question. This is sort of a let's try to be as informative as possible. You're as close to it as anyone. How would you approach it, and what advice would you give to folks who are trying to determine eligibility?
Yeah. I would start by going to the website to understand what benefits may exist and understand what eligibility requirements exist. I may call the contact center to ask an employee. I may walk into a regional office, or I may pick up the phone and contact a county VSO, an accredited representative like the American Legion, DAV, or VFW, or work with an organization like TAPS. And oftentimes you might find a friend or a loved one who is also a survivor and ask them.
And can you list again the top benefits that folks are entitled to, that are eligible for?
Yeah. So disability and indemnity compensation, there's survivor's pension, there's home loans, a variety of life insurance programs, education benefits. There are health care and bereavement services and burial and memorial services as well.
Let's say you hit a snag in this process and you're trying to determine eligibility. Maybe you've gotten on the phone. One, having done the journey map and talked to a lot of survivors, what are the top 2 or 3 snags, and how would you recommend people work through those?
Yeah, one of the things we talked about, the length of the forms, the applications, and so maybe you don't fill it out correctly. So having someone to help you, you can call up the regional office, you can work with a VSO. That tends to be one of the biggest challenges, and the biggest snag is just lack of awareness, so understanding what you're potentially eligible for to start with.
And for congressional offices that have caseworkers that work on these issues, that's a pretty good place to go if you hit a snag, right?
Absolutely. I spent 10 years working in Congress, and so I know the importance of the casework function for members. I would also say, in addition to helping those individual survivors and veterans and taking care of their specific needs, I think it's also a good source of information for us. This is a large organization, 600,000 survivors, about 6 million veterans that we serve. We know things are not always going to work as they should, and so getting that intel and being able to differentiate between what's an isolated issue and perhaps a systemic issue is really important for us.
I appreciate that and appreciate the way in which you've approached some of these questions and this mindset of continuous improvement, and appreciating the fact that you all have served more veterans, more survivors, However, you got to get better every day. There's so much on the line. And to that end, when I Googled the website, just thinking to myself, if I were in one of these awful situations, and you talked about the stress and the grief, the confusion, you Google the website, you get online, it gives you a sense of what you might be eligible for in that there are categories. But I did not see, maybe I just missed it, a way in which you could just fill something out, something pretty basic that would allow you all at the VA to capture my information to let you know that I'm looking, and to determine for me, if I might be eligible. And we had this program in Ohio. It was called the Ohio Benefits Bank, where everyone, the VSOs, in this case nonprofits, they would be able to sit down, simple platform that allowed people to say, here's my situation very clearly, and then it would say, you may be eligible for X, Y, Z, so on and so forth, and then all of a sudden the conversation started to materialize and things happened much more quickly.
Yeah. So we actually have a draft quick eligibility quiz for survivors' benefits. This is not something that we've distributed, but it's a prototype that we've developed that we're working to verify and validate it as part of this survivor experience project, and it's something that we're actively looking to do.
That, to me, would be very, very helpful if we can get it online and make it so it's super easy for folks to fill out and immediately know if they might be eligible, and you all immediately know that somebody is engaged in trying to determine eligibility. With that, I yield back. Thank you.
Thank you.
Representative McGarvey.
Thank you, Mr. Chairman. Mr. Jacobs, thank you for your testimony. I do think it's at least encouraging to hear about the many programs and all of the benefits that are available to families of service members. However, I too share the concerns you've heard about the low uptake and the underutilization of these benefits, particularly the survivors' benefits, across the different administrations of the VA. Something's not working. And we hear about this all the time. It's lengthy applications, delayed appeals, complex eligibility requirements, lack of clear, consolidated information. When you talk to people going through this, they are frustrated, and it is so easy to see why. In fact, I understand why people sometimes give up during this process. So that's a problem. And that's on the good side. That's if they know there were benefits in the first place. Not enough know that the benefits are even available. So we need clear, simple, easy, effective outreach, easy applications, automatic enrollment in these types of things. It sounds like the Office of Survivor Assistance is working hard to engage survivors through email and phone lines, outreach events, community partners, and more, but it's still not working. And I think that is my takeaway from a lot of the experience here. So my question to you is, what will the strategy be to test a variety of engagement practices to see what works best and what results in increased uptake within the VA's administrations? Because how you all are actually testing this, actually using evidence-based decision-making, not just checking the box, saying, hey, we're working with VSOs or we're working with community stakeholders, when we don't even really know what that means. Because again, the numbers show something's not working. So how can you guys start to do a better job of figuring out and testing these methods?
Well, I agree that there are many more survivors that we need to reach to both make aware of these earned benefits and to connect them to these earned benefits and the support. I think that the strategy starts by actively seeking out feedback from our customers in the survivor community. That's what we're doing to update the survivor experience effort. And then understanding, because what we have been doing hasn't enabled us to meet as many survivors and serve as many survivors as we think are out there, figuring out how we adapt our approach. This is not a situation where we're coming from DC and saying we're here to help. We're actively trying to target our solutions based on the feedback that we're hearing. Because the efforts that we've done to date, whether it's through the emails, the outreach engagements, the collaborative efforts, they're not enabling us to meet and serve the survivors that we think could benefit from the support system. And so we need to actively hear what are the things that we can do better and design our solutions around that feedback.
And again, I appreciate that. It's still not an answer I can put my finger on and say what you guys are doing. And one thing I know in any job, in this job and the private sector jobs we all had before doing this, or public service jobs, you can get in silos. We've seen some more successful outreach happening with the PACT Act recently. And maybe there's some lessons learned from that. So how is the VA internally sharing some of these lessons about how we're reaching out to our veterans? And again, asking for concrete answers here.
Sure. So one of the things that we're looking to do is we have what are called Veteran Engagement Action Centers. These are outreach efforts where we bring the entire department together to allow for in most cases, veterans and survivors to come and ask questions about benefits, about healthcare, about cemeteries. We're looking to do something targeted specifically to survivors, where we can allow for survivors who are already accessing the system but may not have considered it another benefit or have questions about a pending claim to come in and get help, or for those survivors who have not yet engaged with VA to come for the first part. And so looking to proactively design that and then reach out to the community to bring them in to better support them.
Thank you, Mr. Chairman. I'm out of time. I just think there's a really great opportunity here for us to begin thinking of different things and using evidence-based decision-making so we can put our finger on what's working and what's not working and how we help our vets.
Thank you. Before we release panel, I just got one quick question here. When will the eligibility quiz that was made from the 2019 VO survivor study be implemented?
So we should finish up the entire survivor experience process in the next few months and then make a decision as part of that with the quiz. And so the goal is what we wanted.
I thought that was done already in 2019.
Yes, and my understanding, I wasn't here at that point, I think they put it on hold as a result of COVID. I don't fully understand the decision-making by kind of the previous leadership, but what I'll tell you is we're working to revalidate the findings and then want to send that out. The thing that we just want to be careful about is, as we have that eligibility quiz, is we make sure we don't leave anyone with the impression they're eligible for something that they're not. So making sure that we're tailoring and designing it in a manner that's appropriate.
Well, thank you for being here, Mr. Jacobs, Dr. Upton, and Mr. Friel. Thank you for your testimonies today, and you're excused, and now we're going to try to seat the second panel, if we could, please. All right, I'd like to welcome the second panel today. And I'm going to tell you something. You know, I do pronounce names fairly well and butcher them occasionally, but I'm telling you that this, trust me, I'm going to do the best I can with every one of your names, okay? Okay, first we have Miss Gabrielle Coubinier. Did I do that all right? Coubinier. All right, Miss Kanan Mackey Fugler. Okay. Then we have Ashlyn Haycock Lohman. And we have Miss Kelly Ruska. I'd like to recognize myself to introduce Gabrielle Coubinier. There you go. Her husband, Petty Officer Second Class Jeffrey Farron of the U.S. Navy, tragically passed away at the age of 31 while serving on active duty. She has since dedicated herself to serving the veterans and their survivors, including with organizations such as Veterans of Foreign Wars and the Gold Star Wives of America. We want to honor you for that, and we're here and welcome you here today to share some important perspectives that you've lived through. So you're now recognized for 5 minutes.
Chairman Bost, Ranking Member Takano, and members of the committee, on behalf of the men and women of the VFW and its auxiliary, thank you for the opportunity to provide our remarks on issues related to military and veteran survivors. The VFW has long advocated for an increase in benefits and services for family members who have sacrificed alongside of their loved ones in support of service in the United States military. As a member of the VFW Auxiliary, a member and now president of Gold Star Wives of America's Arlington chapter, I have made it my mission to support and advocate for survivors. My employment as an accredited veteran service officer and caseworker for the VFW was instrumental in providing me the means and resources to help survivors access their benefits and maneuver the VA system. I became a military widow on April 2nd, 2012, when my 31-year-old husband, Petty Officer Second Class Jeffrey Farron, suddenly died due to an undiagnosed heart condition. We were high school sweethearts living in Chesapeake, Virginia, where he was stationed for duty with the United States Navy. Nothing can prepare a person for the pain and confusion that comes with the loss of a spouse. When a veteran dies, VA needs to be informed of the death and then will attempt to contact the spouse or dependents, informing them that they can apply for benefits. This is key. The survivor has to apply for benefits. They are not automatic. The most important thing VA can do to prepare survivors is to talk openly about the fact that veterans' compensation ends the day they die, period. Veterans and their spouses need to be informed that they may be eligible for DIC. The loss of income is usually a surprise for survivors. It shouldn't be. Every family should be fully aware that when a veteran dies, whatever benefits they are receiving from VA will end. This way, they can then make decisions based on that fact. After my husband died, I decided to pursue continuing my education at American University, the only VA education benefit available at that time for survivors was the Dependents Educational Assistance, DEA. While the funding was helpful, the total amount of assistance I received that semester was less than the cost of 1 month's rent. Years later, I decided to pursue a master's degree at George Washington University. By this time, the Frye Scholarship existed, and if it were not for that, I would not have been able to afford the master's degree I recently completed this past May. After losing my husband, I moved back to my parents' house in Teaneck, New Jersey. I eventually started going to counseling at the Secaucus Vet Center. My therapist had also been a military spouse, and her husband was a disabled veteran. The work we did together resulted in my applying to graduate school courses and making the move to Washington, D.C., where I knew one person, someone I had met through TAPS. There's no way that I would have had the courage and ability to move forward with my life had it not been for that therapist at that vet center. So after moving to DC, I went to the local DC vet center and was assigned a female therapist as requested. After some time together, my weekly sessions were reduced to every other week. I was told this was because the vet center was trying to accept more patients. Then I received a call from my therapist letting me know that she would have to discontinue our sessions. She said survivors were short-term vet center customers and that my time had expired. Now, once this was brought to the attention of the VA headquarters staff, my therapist called back to let me know that I could continue therapy with no time limit. I was told that this was a policy misinterpretation by middle management and that corrective action would be taken. A month later, my therapist quit. I decided I would wait for another female to be hired so I wouldn't have to switch providers over and over. It is now 2 years later. I have not had any counseling since. Year after year, the VFW and advocates like me ask Congress to improve on a variety of survivor issues. And legislation is drafted, but never receives the needed votes to enact the significant changes. I strongly urge this committee to find pathways necessary to make sure that survivor benefits are taken seriously and not pushed off again for the next Congress. Chairman Bost, Ranking Member Takano, thank you for the opportunity to share my testimony today. I look forward to any questions you may have.
Thank you very much. Next, I'd like to recognize myself again to introduce our second witness, Miss Mackie Pfluger. She is surviving spouse of Staff Sergeant Matthew Mackey, who passed away after an accident during active duty. She is also a mother of 5 Gold Star children. She is a tireless advocate for military and veteran survivors community, including the Tragedy Assistance Program for Survivors. We are grateful for Miss Mackie Pfluger, that she's traveled all the way from Louisiana to be here today. And with that, you're recognized for 5 minutes.
Thank you. Chairman Bost, Ranking Member Takano, and distinguished committee members, I thank you for the opportunity to share issues and challenges surviving military families face accessing our benefits through the Department of Veteran Affairs. My late husband, Staff Sergeant Matthew Mackey, served in both the Marine Corps and the Iowa National Guard for nearly 2 decades. We had 12 years together, but spent nearly 10 years of that time separated by training, schools, or deployments. In 2010, Matt died as a result of an accident, and I was left alone to raise our 5 young children, who were between the ages of 2 and 11 years. I watched heartbroken as my 9-year-old son ran out of the room bawling, wanting to know who was going to teach him to be a man. Matt didn't want me to spend my life alone or for our children to grow up without a father figure. In 2017, I was lucky enough to find somebody who was honored to take on that role, and my now husband, Josh. Josh was willing to wait the extra 24 years until I turned 55, but it was important for us to show my children that love and morals were more important than money. When Matt died, I was repeatedly told that it was a debt that could never be repaid. But losing my survivor benefits when I remarried feels as though our country is saying, the debt's now paid in full. As if I stopped grieving Matt or the challenges of living this life, raising our kids without him just disappears. People are not replaceable. A piece of paper will never change that I'm Matt's widow. It just means that I'm also somebody else's spouse now. It doesn't wipe away the 12 years I spent sacrificing my own career while Matt served, nor the 13 years after his death I've spent raising our broken family. And though I utilized my education benefits, the gaps in my education and my employment are going to impact my earning potential for the rest of my life. My survivor benefits help not only offset my husband's income, but my loss of my own income as a result of our military life. I faced many challenges as a surviving spouse, but even more so as a remarried surviving spouse. My remarriage created 2 files within the VA since I remarried a disabled veteran, one under Matt and another under Josh. When I remarried, I reported to the VA within 30 days of receiving my marriage license. I was told it would take 8 to 12 weeks for my benefits to be turned off. I then spent the next 7 months making phone calls, sending faxes, getting TAPs involved, even a congressional inquiry. I did everything short of closing my bank account to stop my benefits. Nearly 10 months after I remarried, my DIC finally stopped. I then received my debt letter for over $12,000, which I disputed. 5 years later, I sat before the Board of Veteran Appeals and shared these challenges. And 2 months after that, I received a letter stating that my debt was forgiven. These are just the obstacles that I experienced as a surviving spouse. My children have faced many of their own challenges. For example, when surviving children turn 18 while they're still in high school, they're required to submit VA Form 21-674 60 days before their birthday. Our children aren't filing new claims, but continuing their eligibility while they're still in high school. Unfortunately, VA has not developed a way to process these claims in a timely manner. My 4 young adult children have all been through this process, and each one faced a completely different barrier to ensure their DIC continued. It took 5 months for Alexis, 7 months for Chloe, and 9 months for John, John was actually in college and out on his own before his case was rectified, yet we were told that he didn't meet the criteria for a financial hardship. And our son Aiden's paperwork was submitted this past August, and we're still waiting for his DIC to be reinstated. In addition, our children are only paid DIC through the month they graduate high school, even though VA policy states that they can receive this benefit until they begin utilizing education benefits. None of my children have ever been paid past their graduation month. In closing, I'd like to restate how grateful I am to testify before you today, because many of the issues that I've raised today, Congress has the power to fix in a single comprehensive bill. Passing Love Lives On Act will allow surviving spouses to remarry before the age of 55 and retain their benefits. And this would eliminate many of the challenges. In reference to the VA Form 21674 issue, I'm confident the VA can update their processing procedures to make this transition less complicated for surviving children. In addition, allowing DIC to be paid to our surviving young adults through the summer after graduation would eliminate any gaps that could cause undue hardship. And I thank you again for the opportunity to share my experiences with you and look forward to answering any questions you may have.
Thank you very much. Next, we have Ashlyn Haycock-Lohman, Director of Government and Legislative Affairs for the Tragedy Assistance Program for Survivors. Ms. Haycock-Lohman, you are recognized for 5 minutes.
Chairman Bost, Ranking Member Takano, and distinguished committee members, the Tragedy Assistance Program for Survivors is grateful for the opportunity to testify today on behalf of the over 120,000 surviving families TAPS is honored to serve. I am the Gold Star daughter of United States Army Sergeant First Class Jeffrey Haycock, who died while training to deploy in 2002, and Air Force veteran Nicole Haycock, who died by suicide in 2011. I personally understand how life-changing our VA benefits are to our surviving families. Our TAPS written statement highlights many of the most common challenges survivors face in accessing benefits, but I will focus my comments on just a few. The most crucial is for our surviving children. If a surviving child turns 18 before graduating high school, dependency and indemnity compensation should be paid to the child until they graduate. This is not happening. TAPS has consistently raised this issue with the VA over the past 5 years. Unfortunately, the VA has yet to develop a way to process these claims in a timely manner, leading to 18 months and longer delays in payments for all of these students. These should be easy supplemental claims, but every child has experienced a delay in payment due to a lack of a reasonable process for these claims. Many of these surviving children give up after years of trying and never receive the back pay they are owed. We appreciate Undersecretary Jacobs and his team working to identify a permanent solution. In addition, not only is DIC supposed to be paid until a child graduates high school, they should receive DIC in the months between graduation and starting college. Despite this being the law, students are not paid during the summer months. TAPS recommends a process for students to submit a single school certification form that will generate into the national work queue. Additionally, the VA Education Office should be required to notify the Pension Management Center of a surviving child's enrollment in education benefits so pension can release those additional funds. Under the Forever GI Bill, all FRI eligible children whose loss occurred on or after January 1st, 2013, or who turned 18 on or after that date, should not have a delimiting date. Yet nearly half of the certificates of eligibility TAPS has seen this past year still have one. TAPS recommends moving all Chapter 35 and FRI scholarship claims to one RPO with specialized claim processing to reduce errors and ensure consistency in certificates of eligibility. When an active duty service member passes, the Department of Defense reaches out to the family, guiding them through available benefits and programs. The VA lacks a similar capability, as it does not track family members who are not currently receiving benefits, which is the case for most survivors. Additionally, non-active duty surviving spouses are expected to navigate the same entry points as veterans, such as the VA's General Helpline. During their initial call, survivors often receive inaccurate information or are told they are ineligible for benefits. This leads to survivors hesitating to return to the VA for assistance. TAPS recommends creating a separate VA entry point for survivors and an 800 number specifically for surviving families to ensure they receive adequate support and accurate information. The VA's Office of Survivor Assistance would be the logical entry point, but far too many survivors don't even know it exists. Currently, OSA only has 3 staff members to support over 465,000 eligible survivors. TAPS recommends permanently moving the Office of Survivor Assistance into the Office of the Undersecretary of Benefits. TAPS is also OSA has also been treated as if the only benefits survivors receive are compensation. Currently, OSA staff only have access to DIC and pension, therefore are unable to assist with survivor issues like burial, education, healthcare, life insurance, and home loans. TAPS recommends expanding OSA's access to information to include all survivor benefits. The limited awareness among survivors regarding OSA highlights the need for VA to more effectively communicate and promote this survivor program to deliver on its sacred mission, to fulfill President Lincoln's promise to care for those who have served in our nation's military and their families, caregivers, and survivors. Every year, the VA sends letters randomly asking survivors if they have remarried. Surviving spouses are required to send them back, confirming their marital status. The VA then terminates DIC when they do not receive those letters, usually because the survivor never received it to begin with. VA does not consistently send the remarriage letters, so survivors are not proactively expecting them. The only way for a survivor to know if VA received their return letter is if they stop receiving DIC. If VA turns off their benefits, it can take months for them to turn back on. Additionally, when a surviving spouse remarries under the age of 55, they are legally required to notify the VA. VA states its processing times are 8 to 12 weeks, but the reality is more like 6 to 18 months. Survivors often have to make multiple calls and resend paperwork before being informed that their file hasn't even been reviewed. Because these survivors are being paid when they are no longer eligible, they are then sent debt letters and expected to pay back the benefits immediately. TAPS recommends passing the Love Lives On Act, which allows our surviving spouses to maintain benefits upon remarriage at any age and would alleviate many of the challenges our surviving spouses currently face. Thank you for the opportunity to testify today, and I look forward to answering your questions.
Thank you. Finally, we would now recognize Ms. Kelly Ruska, Government Relations Director for the National Military Family Association. Ms. Ruska, you're recognized for 5 minutes.
Chairman Bost, Ranking Member Takano, and distinguished members of the committee, the National Military Family Association would like to thank you for the opportunity to present testimony today on supporting America's surviving military family community. The VA provides surviving family members with an annual summary of benefits letter that indicates the amount of dependency and indemnity compensation the survivor should receive. Not only does the letter provide important information for the survivor, but the letter may be used in applying for benefits such as housing entitlements, state and local property tax relief, or any other verification of VA benefits that may be required. This letter is an official record of the survivor's VA entitlement. Unfortunately, we've heard from surviving spouses that they don't receive this important letter. The Veterans Benefit Administration must ensure that the summary of benefits letter is sent to all beneficiaries annually. Not only are all surviving family members not receiving this summary of benefits letter, but the information included in the letter is broad and may not be relevant to the surviving family members. For example, the VA benefits information doesn't provide an itemized list of compensation. The DIC is presented as a lump sum. If the surviving spouse is receiving an add-on to their DIC, that add-on is included with the DIC payment. The lack of itemization leaves many surviving spouses wondering if they're receiving all of their benefits, and that may be unprepared when temporary add-ons like that they're receiving, such as child allowances, aid and attendance, or household payments, are maybe ending. Our office receives several phone calls a month from surviving spouses asking us to help verify that they're getting their VA benefits. If the letter were more specific, surviving families wouldn't have to guess or rely on outside organizations for verification. Counsel and advice on a continuing basis should be available to surviving family members. The surviving family will have questions as the years go by and their needs change. The young widow with a toddler has too many immediate concerns to think about a child's college education 15 years from now. However, the family will be looking for information at that time about those benefits. Will they be able to access the information and advice in an easy manner with someone who's an expert in the benefits for families? Will they walk into an office where the counselor is more familiar with VA health benefits than they are for benefits for surviving family members? The surviving spouse needs information unique to their family and not a cookie-cutter, one-size-fits-all answer. Entities that provide this type of survivor-focused service used to exist. Having an office in the Department of Veterans Affairs or organization now that could provide advice and assistance would be very helpful to surviving family members. The VBA has done a great job developing online resources for surviving family members. However, when considering how information is shared, it's important to keep in mind the needs of the population being served. Unfortunately, not everyone has access to online resources. Many of our older surviving spouses, the 41.1% of surviving spouses over age 75, may not use or don't have access to a computer. VA needs to meet surviving family members where they are. The VA needs to deliver information in different ways for surviving family members to get accurate information from trustworthy services. Dedicated phone lines and trusted individuals to review benefits and help in applying for those benefits would fill a deepening gap. The Office of Survivor Assistance was established by Public Law 110-389 on October 10, 2008. The legislation directed the Secretary of Veterans Affairs to establish the office in the department. Congress intended for OSA to serve as the primary advisor to the Secretary on all matters relating to policies, programs, legislative issues affecting survivors. The committee expects that by placing the office under the department vice the Veterans Benefit Administration, the full spectrum of VA benefits and services would be addressed. This office would allow for specialized expert staff to provide internal policy guidance and oversight of benefit for survivors. NMFA advocated for the establishment of OSA and attended the first working group meeting. We were hopeful the office would serve as a dedicated resource and advocate for families that Congress intended. However, recent events leave us concerned. Despite the specific language of the law, OSA has moved twice in recent years. First, in February 2021, OSA was shifted to the Office of Outreach, Transition, and Economic Development. June of 2023, OSA was again moved, this time to the Office of Pension and Fiduciary. This reorganization appears to remove its intended role as primary advisor to the Secretary. The law has not been changed to permit these changes. NMFA believes these moves undermine the responsibility and authority of the original mission of the office to oversee and protect the well-being of survivors. Thank you for the opportunity to share our thoughts on the VA's programs and services for survivors. We appreciate the committee holding this hearing to discuss the oversight of these important issues, and we look forward to your questions. Thank you.
Thank you. I recognize myself for 5 minutes of questioning. Ms. Cubier, could you compare the level of assistance received by survivors of service members who pass away in service with the level of assistance provided by VA to the survivors of veterans who pass away after their service?
Yes, thank you, Mr. Chairman. Active duty survivors are assigned a casualty affairs calls officer for the Navy. That is a person who leaves their job, whatever it is, and they are assigned to the survivor for however long they need them, weeks, months. My Keiko actually drove me to the VA office, walked in with me, and helped me, sat right next to me, fill out all of the forms and give them to the VA employee. The Keiko helps with all of the paperwork. When your husband drops dead in front of you, your brain stops working for a while. I was very lucky. I had two of my best friends who made it to Norfolk before the Navy got my parents there. They sat between me and the Keiko. They looked at all the paperwork before they looked at me and said, okay, we understand this, sign this. If you're a survivor of a veteran, if nobody knows, nobody helps. My dad's a disabled veteran. He will probably not die from what he is disabled for. My mom will not be entitled to any survivor benefits. My mom also married him after he served. He has gotten only help from the VA very recently. She has no idea about VFW, about Gold Star Wives, about any of these organizations because my dad was never involved in them. It is vitally important that we reach the people who are not involved with the VSOs. The VSOs have service officers. The VSOs have auxiliaries. They have survivors who are able to help, and they are an amazing community. So if you're active in your post and the veteran dies, there are people there who are friends who help, who also are trained. That is one of the magical things about VSOs, is the community it provides, and then continues to provide with VA-accredited help. If you are not part of those organizations and you know nothing about them, how would you ever go to them? When my husband died, he died at home, like stateside. I never even thought call the VFW for help. It never even crossed my mind. It wasn't until I moved to DC that I learned about what all the VSOs do. And I was an active duty spouse. So it is a vastly different level of care and support that active duty survivors receive versus veterans.
Thank you. Ms. Maggie-Pfluger, can you elaborate on how challenging it was for your children to access DIC after you remarried?
Thank you, Congressman. It was very difficult for my kids to access their DIC after I remarried, and I think the process stemmed from having to wait until my benefit was shut off for theirs to begin. So when I ended up with the debt letter, it was my debt because it was their payment for that time frame. And then we go through where I am not even considered their parent anymore. I'm considered their fiduciary. How terrible is that to have to hear as the only living parent that the only concern that anybody has for you is the financial well-being of the money that they're given as a death benefit? That's terrible. And that's one of the big problems with getting remarried that I wish I knew before I did, because it's caused many issues regarding my child's health care. I know in my written statement, I wrote about my 9-year-old being diagnosed with type 1 diabetes in an ICU room, and no one would speak to me. I had to sign a form giving myself permission for them to speak to me on my 9-year-old's behalf, because I'm not considered her parent anymore. I'm just her guardian. And it's absurd, the whole process of that.
I don't have time to get another question in, but go ahead and turn over to the ranking member.
Well, thank you, Mr. Chairman, and I just want to acknowledge all of your journeys. Very moving testimony by all of you, and your resilience is inspiring. And I'm also inspired by your courage. You're all leaders in your own way, making meaning out of the loss of your loved one by taking up this cause. So I just want to acknowledge that and thank you for being here. So Ms. Haycock-Lohman, as I mentioned in my opening statement, I will be introducing a bill to create a program similar to VA's Solid Start program, where survivors are contacted multiple times in the year following the death of their loved one to ensure they know about benefits they might be eligible for and how to apply for them. Do you feel that a program like that might be beneficial, and would you recommend the Office of Survivor Assistance to be the appropriate office to provide this service, assuming that it has the resources and staff, which the bill also seeks to address?
Sure. So we generally are very supportive of the Solid Start bill. We support increasing the staffing. We support increasing the resources. We do want to make sure that as long as they are doing that outreach, that we're also still making sure that they are supporting the survivors that are coming to them, as that seems to be a current challenge. And then as for the demographic information, we support gathering additional demographics. One thing we would flag is that VA does not currently track cause of death. So we would love to see that as an addition to data that's being tracked.
Great feedback and great suggestions. Ms. Hruska, the Honor in Our PACT Act provided eligibility for surviving spouses to access benefits as their veterans' toxic exposures are now being recognized. However, the PACT Act approvals for survivors seem to be lagging behind, which speaks to an outreach problem. Can you speak more about the need for outreach to survivors as they are accessing benefits they might soon be eligible for, as well as the need for continuing outreach throughout the lifespan of survivors?
Thank you, Congressman Takano. I think it's important that VA not just depend on VSOs to do outreach to surviving spouses, but they look at this as a whole of government effort. So utilizing where are those touch points that other federal agencies are interacting with survivors, maybe such as the Social Security Administration. And so using those opportunities to communicate with everyone that those benefits could be available, and here's where you would go to access those benefits or to check eligibility.
So how might a proactive outreach campaign, meaning a campaign that seeks to reach survivors before they're in a position of being survivors? I mean, while the spouse is still alive, making that couple and that family understand more about these benefits. How might such a proactive outreach campaign improve the lives of survivors?
Well, it would definitely make them more aware of them, so that, as both Gabby and mentioned, that when it happens, you're in shock. So if they're proactively knowledgeable, then it's not so much of an information dump. And they can know who to outreach to get those and access those benefits.
It certainly would help understand, make more understandable the stakes of remarrying and that sort of thing, if they were to understand how these benefits work, I would assume. Ms. Haycock-Lohman, you've highlighted processing and claims adjudication issues for beneficiaries attempting to use Chapter 35 or the Frye Scholarship, especially when the beneficiary also has GI Bill eligibility from serving themselves, or if it was transferred to them from a parent because the individual has multiple files in VA systems. I can certainly sympathize with the frustration the Gold Star families experience from the confusion and delays these mix-ups cause. Should VA move to a specialized group of claims processors to handle claims for Chapter 35 and Frye Scholarship beneficiaries? Would that reduce errors, do you think?
Yes, we strongly believe that we should relocate Frye and Chapter 35 to one of the RPOs and very specialized claims processing. A good example of that is that all active duty DIC claims were moved to the Philadelphia RPO, and it has massively reduced the challenges and errors we saw for those claims. We think that the biggest challenge is that there is inconsistency in the certificates of eligibility that are coming out. There are a lot of cases where there should not be a delimiting date on them, and we're still seeing that fairly consistently across the board. And so if we can help make sure that the claims processors who are specifically processing those claims are incredibly knowledgeable about the very nuanced technicalities, it would reduce overall errors.
Well, thank you so much, Mr. Chairman. I yield back.
Representative Self, you're recognized.
Thank you, Mr. Chairman. You've changed my second line of questioning. I think most of you heard that I was asking about the VSOs in our first panel. But Ms. Kubini, are we talking about surviving spouses of veterans that were receiving VA benefits? Because you said they're not involved with the VSO community, but they were receiving VA benefits.
I was more referring to spouses who are not involved with VSOs.
Right.
And they're not necessarily, their spouse may be receiving VA disability or any of the benefits that are available, but they may not even know that there's a DIC after.
I understand. So you're a representative of one of the major VSOs. How many are we talking about? What do you think?
That don't know?
Yeah. Surviving spouses of veterans that may not either be capable or don't know about benefits. What's the universe?
I could not put a specific number on that, but I would be willing to say from the work I've done at VFW and the older, specifically older survivors who would call in shock, in dismay of what the benefits were, which led me to believe they had no idea what was coming. And it was a significant amount of the older, like 70+ survivors. So again, I can't put an exact number, but it's not one or two.
Anybody want to take a, no? Okay. I want to also ask you about, you are not a parent, but a guardian. Is that an official designation?
So per policy between VA and DOD, I am either considered a guardian or a fiduciary for my children. So I'm in all pieces of mail. I actually have a whole binder here of what it's like going through the VA process and having children. It states that I'm a fiduciary, taking care of their financial needs. And like I mentioned, I had to fill out basically a HIPAA form to be able to talk to TRICARE to find out how to take care of my daughter while she was in ICU.
Okay, let me ask it a different way. What rights do you know that you have lost as a parent?
So we actually have a piece that was in NDAA last year, I believe, regarding the electronic access for my children. I do not have electronic access to any of my children's benefits. I'm no longer privileged to that information. So apparently upon remarrying, I'm, I guess, not trustworthy enough to have access to personal information about my children on the DMDC website or on their e-benefits website. My adult children can't even access their own information right now on e-benefits or use their ID.me to log in and certify enrollments if they have changes, because that's done through their dad's ID card. So it's all my children's benefits that they're entitled to that they're not really able to use because I don't have access to them.
Do you have say-so, do you still have children at home?
I still have one minor child at home.
So do you have say-so over health care for your minor child?
So yes, after I sat in a hospital room while she was in ICU and filled out a HIPAA form, I do have access to her health care by the telephone.
Do you have authority over her health care?
Yes.
Okay.
We have to use a lot of pre-authorizations and things for her medications. We have to do all of that through the mail or through a phone call. So anything that is authorized for her, I have to wait for that to come to my house through snail mail before we know whether it's been approved or not to take care of a portion of her health care.
Okay, does anyone else want to comment on that same question? Yes, ma'am.
I would just add that she does not have access to the electronic medical records piece. So she can call and send in forms, but she can't access any of the online piece of it. And while we did technically fix that in the 2022 NDAA for the TRICARE piece, DOD has yet to implement this, even though it was supposed to be effective immediately.
And sir, I'd just like to mention that she has to jump through all of these extra steps that any other family would not have to. And that's just not acceptable.
Is that because you remarried? Is that what you're saying? It's because you remarried?
Yes, sir. It's completely because I remarried, making me no longer my deceased husband's dependent in these systems.
Thank you. Very enlightening. I yield back.
Representative Browning.
Thank you, Mr. Chairman. I certainly wanted to associate myself with Mr. Takano's words. Thank you for being here. Recognize your resilience and your courage for being here, and thank you for trying to pave the way for, sadly, future men and women who will be in your situation, who will have lost their spouse. So I really do thank you for being here. Ms. Hancock-Lohman, I wanted to ask you, you know, I have this bill on ChampVA to extend access for health care to 26 years of age. I'm just curious to know of sort of the cases that you go through and so forth. Do you hear this a lot, particularly children who graduate from high school and don't go on to college? I think they're still covered until 23, but still. So can you talk about that a little bit?
Sure. So they're, unlike even TRICARE, where there's an ability for the families to pay for that service until the child is 26, there is none of that for ChampVA. So once they're cut off, they are cut off. And one of the things that we see most consistently as a concern with that is access to mental health, especially for our surviving children. Making sure that as turning 18, graduating high school, that's a big transition. And it's also an incredibly big transition when you're grieving the loss of a parent. And so making sure they have access to that continued mental health care, especially if they maybe take a gap year or take time to figure out what they want to do, because the last thing we also want to do is see our survivors waste their education benefits because they feel they have to enroll to maintain health insurance because they don't have even an option to buy it. It's one of the things we see consistently, but our biggest concern has been access to mental health care for these transitioning children.
Thank you for that. Ms. Mackey-Fogler, you talked about all of the trials and tribulations with your children and receiving DIC benefits. At the end of the day, did they get their payments retroactively?
So each of my children have received their payment after they graduated high school. So all of my children have had months of process where they had no payment at all. And in one of my child's cases, he was actually denied his education benefit, first because they claimed that his father was not deceased. Then it was because his father didn't die in the line of duty. And finally, the third time they got it right and gave him his benefit. But that's detrimental for an 18-year-old to open a letter for their prize scholarship that's supposed to send them to school and hear that they are denied because their dad's not dead. I mean, how terrible to deal with those emotions. And that's really why we really would like to automate the COE. I don't think that's a difficult thing to do. I know they do it on the survivor benefit plan side through DOD for our kids. Every July they send in their form, and we have no problems with benefits on that side getting turned off, waiting months to get those benefits. It's within the month it's taken care of.
Thank you. Ms. Ruska, you mentioned a couple of things in your testimony that I wanted to follow up with you on. You talked about the OAS moving, and it's moved several different times since its inception. So, I think you mentioned something about the law doesn't allow that movement, or did I understand you correctly?
The law was very specific as to where the Office of Survivor Assistance should be located and the reasons why.
So in other words, the VA is not following the law?
Yes, ma'am.
Thank you. You also talked about access to website and access to knowledge about what benefits surviving spouses have. And you sounded pretty complimentary, so I except for those who don't have access, which I completely understand. So is it true that one can go to a website, a VA website, and go to one place to find out what all of the benefits are for surviving spouses?
So the VA website does have those benefits. I think Ashlyn mentioned in her written testimony that that the websites sometimes are not as updated as they should be, but the information is there, and they give you a number that you can call. But the problem is that some people who are maybe more comfortable using the web might think, well, this is the information, and so take what they're seeing at its face value. You do have access to forms, and so in that respect, it's great, but the web pages could be updated more frequently.
Understood. Well, I'm just, for the record, I'm happy to hear that, because for most cases with regards to benefits for veterans, they have to search all over the website to figure that out. So I'm happy to hear, at least in this case, they're all in one place. But I do recognize your testimony around access to that technology. So with that, I yield back. Thank you.
Thank you. Mr. Van Horten.
Thank you, Mr. Chairman. I want to congratulate you in putting together a panel with the most difficult to pronounce names I've ever seen. So it's remarkable. So if I butcher these, please forgive me. Miss Kubini and Miss Mackie Fugler and Miss Haycock Lohman, I want to thank you for coming up here today. It takes real courage. It does. Do we have any more Gold Star spouses in the crowd back here? All right, thank you very much. You're welcome. I've had about 50 of my friends killed since 9/11 in training and combat, and what you said means something to me. This is not a debt that gets repaid. It is not a mortgage, and you wanting to remarry and start your life again should not be penalized. It just should not. What a better way to raise children than in a stable, nuclear family. So that's just junk, and we got to get rid of that. Absolutely. I'm the chairman of a subcommittee that's in charge of Chapter 35 in the Transition Assistance Program. So we're looking at the TAP program itself to make sure our curriculum is meeting some type of need. But clearly, Ms. Hruska, your comment about a young widow with a toddler is not thinking about college 15 years later is absolutely spot on. So we need to do something to be able to track these things. Your suggestion of contacting the Social Security Administration, I think, is a lot better than trolling funeral homes, as was brought up in the previous panel. I don't know how that would work, cold calling funeral homes and asking if a veteran died recently. I think that's patently absurd. So because I'm responsible for that in the subcommittee, you're going to hear something out of a government official that you're never going to hear. I'm taking personal responsibility to make sure that we get this going, okay? So if you have any issues at all, I want you to reach out directly to my office, because these benefits are earned, and they're earned in the most horrific way of losing your spouse. So I do owe you a debt, and I will repay it. So that's all. I'll yield back.
Thank you. Representative Rice.
Thank you, Mr. Chairman. And first of all, I want to thank all of you and everyone who is in the audience and the panel up here today. I can't imagine how difficult it is if you've lost a spouse and the impact it's had on your children, that how difficult it is. But it takes a lot of courage to come up here, to come up to DC, and a lot of effort. The VA is so got it backwards, and sometimes so does the DOD. And I come from a military family. I graduated from the Citadel, and although I did not serve, my father spent 28 years in the U.S. Army serving his country, and he is fully disabled. He will likely pass away from one of his injuries that he continues to have chronic pain from. He had over 500 parachute jumps. I spent 3 tours of combat, 2 in Vietnam and 1 in the 1964 coup d'etat of the Dominican Republic. I have members of my family who are spouses. I have one who cannot get remarried because they are a cancer survivor. If they get remarried, they lose all of their TRICARE benefits. And it's crazy to me to see that this is the way we treat our veterans and their spouses and their children. And so we live this in our family to some extent on a daily basis, and we've seen the impact that it's had, the negative impact. But I can't, Kanan, I can't empathize. We have not gone through that, and I feel your pain as a mom and not being able to have access to your kids' records, especially digitally when you should. It should be easy. If you did this in the private sector this way, the business would go belly up. And to hear the story of DOD not doing what they've been told to do by law is deeply disappointing. I had a hearing on the Oversight Committee last year, and it was regarding just a $300 million software system the DOD was supposed to implement. We spent the money. It came time to implement, and none of the service branches were ready. So that money just got entirely wasted. Imagine what we could have done with that for veterans and their families, right? And so in the remaining time that I have today, I did want to ask a few questions, Ms. Haycock-Lohman. The first one to you, what sort of recommendations, solutions, ideas? And I'm a small parts, big difference because so little gets done around here. It's mostly BS. But this is an area where I know that on both sides of the aisle, hearing from folks, Democrats and Republicans today, that we do want to work together in a meaningful way. What are some recommendations and solutions you might have?
Survivors make up such a small percentage of those supported by VA that one of the things we do consistently see as an issue is that whether they call the call center or they reach out through official channels, oftentimes they're not educated enough on survivor issues to answer those questions. So the more we can do to make sure that there are a small handful of people processing specific survivor issues, such as moving all of the Chapter 35 and FRI scholarships to one RPO, or making sure that there's a 800 number for survivors to call that can answer those questions. We know it's not going to be a huge influx coming in, but it's making sure that when they do call, they have a place where they know they're going to get answers that are specific to survivors. We talked about the Office of Survivor Assistance, but they only have access to pension and fiduciary claims. They can't help survivors with education, health care, life insurance, any of those things. And so their process is to do one of two things. They either send them back to the VA's general helpline, where they once again are recirculated back into the community, or they refer them to organizations like TAPS, where our caseworkers step in and help the families with those issues. And so the more we can do to make sure that the people who are working with survivors directly have access and the ability to support our survivors and make sure they're getting accurate information, the better it will be for our survivors.
Ms. Mackey-Fugler, is there anything you would like to add in terms of possible solutions or recommendations that might, in a small part, make a big difference in the lives based on your experience?
Past love lives on.
What's that?
Past love lives on. It will fix a whole plethora of the issues that the surviving community faces, and giving them the opportunity to choose how they move forward with their life without it being dictated by our benefits being dangled in front of us, having to make decisions that way.
And I want to thank all of you this afternoon for being here. I hope this will be a meaningful conversation. Again, this is an area where we can work together. This is not a partisan place, this type of issue. So please do stay connected with us and our staff and make sure that you hold us accountable. If we say we're going to do something, make sure that we do it. Thank you, Mr. Chairman, and I yield back.
Representative Escamani, you are recognized 5 minutes.
Thank you, Mr. Chairman, and thank you all for being here, and thank you for sharing your testimony. I think it's extremely important. My district, just for background, is in Arizona 6. That's in the southeastern corner of the state. And I have 2 military bases in my district. I also have over 70,000 veterans in my district. So this is an important issue for me, and specifically the surviving spouse one is one as well that I became very interested in. I have a Veterans Advisory Council, and we have veterans from all branches and all different variety and of how long they've served and when they're retired. And we've taken a serious focus on helping through our council as well. That their role is to advise me on the best approach on policy and so on, and to learn about the needs. And the surviving spouse area has been one of the ones that we've been tackling more in depth recently. So this is very timely. Just met with them last week, and we talked about this hearing. So I've been looking forward to this meeting for a while. You know, when I learned that the Office of Survivor Assistance was relocated to the Office of the Secretary of Veteran Benefits Administration, reporting to a mid-level staffer with only 3 full-time staff, I was astounded by that. And this office was created in 2008, as you know, to serve as the principal advisor to the Secretary, and this deprioritization blatantly skirts Congress's intent on the VA's mission, I believe. So to help rectify this oversight, I was proud to work alongside Chairman Boss to ensure survivor issues always have a seat at the table by introducing H.R. 7100, the Prioritizing Veteran Survivors Act, which once again places OSAs within the Office of the VA Secretary as intended, and thereby prioritizes the advocacy and services for our veterans, surviving spouses, and families. So my first question for you, Ms. Kubinyi, did I pronounce that? No? Yes, okay. Did I? Feel free to correct me, please. And, you know, given your experience with different vet centers, what improvements would you recommend to ensure consistency in the quality of care and services provided to survivors across all locations?
The most important thing is to have full staffing of the vet centers. Vet centers are magical places, again, where veterans come and find a community. Survivors do the same. We might not be part of the groups, but it is a familiar place when we're surrounded by other people who have served. So the most important thing is to fully staff every vet center. When you can go to a vet center, when you can call, because now we call directly to the vet center and have to go through the process ourselves, it would be very helpful if they were fully staffed and had room. Because grief is, the more you put it off, the worse it becomes. It is definitely not something that you want to wait years, to deal with. And that is sometimes, at least months was my experience of having to wait simply because there weren't enough counselors there.
Yeah, no, I appreciate that perspective. You said recently, just earlier today as well, the surviving spouse of active duty versus a surviving spouse of a veteran. I think that's why you bring such a strong perspective voice to the table. So I appreciate you being here. Thank you for that. Ms. Haycock-Lohman, a quick question here as well. You mentioned that many survivors do not know that the Office of Survivor Assistance even exists. How would moving the OSA to the Office of the VA Secretary improve survivors' access to VA benefits?
We are not as concerned about the location. Our official recommendation is to move it to the Undersecretary of Benefits because we think they could provide the structure and infrastructure we think OSA is currently missing. They're currently buried under pension and fiduciary, not even in the office of the Undersecretary. But it's more about making sure that they have the support and staff and ability to support our survivors and create that entry point for our survivors that we currently don't have.
It's a good point. That piggybacks off, obviously, what was just mentioned regarding the staffing. So my next and last question, because of timing here, in your testimony, you discussed the inadequate staffing and funding of the Office of Survivor Assistance. What sort of information can someone get from this office related to survivor education benefits? And also, do you feel that this office should be enhanced to provide more support for survivors?
So we absolutely want to see OSA enhanced. Currently, they don't have access to education claims. So if a survivor contacts them and asks about education, they send them either to the GI Bill helpline, which we worked with VA several years ago to design a specific number for our survivors. So if they call 888 GI Bill 1, I want to say it's number 5, it specifically takes them to somebody who can assist them with survivor issues. And so OSA will either send them there or they will refer them out to organizations like TAPS who can assist the survivors with those benefits and have the ability to assist with education claims as part of our memorandum of agreement with VA.
Thank you very much. Mr. Chair, I yield back.
Thank you. I now recognize Chairman Ranking Member Takano for any closing remarks he might have.
Well, thank you, Mr. Chairman. Again, thank you for holding a hearing on this very important topic, and I mean that. I want to thank again all of the witnesses for being here today and to speak on this topic as well. And I want to extend a special thank you to the survivors on the panel and survivors in the audience, and those who are here only with us in spirit. Now, your stories have demonstrated a level of bravery and courage equal to that of our service members. And you deserve every ounce of our effort in creating a VA that is welcoming and accessible, and every dollar of benefits that we can muster on your behalf. That's why I really feel compelled to point out the distinction between how the two different parties represented this dais here are approaching addressing the issue. Yes, this committee does endeavor to work on a bipartisan basis, but I have to point out the difference in approach thus far. Today, I have previewed for you a bill that puts new tools in VA's hands to aid them in reaching survivors where they are and better inform them of the benefits that they have earned. We have members like my colleague Julia Brownlee, who is here just to the right of me, who has introduced legislation to extend ChampVA eligibility. Representative Johanna Hayes has introduced legislation to raise the levels of DIC benefits on par with other federal survivors programs. That seems to me only fair. We have members like Dean Phillips, who has introduced the Love Lives On Act, which would address many of the issues that we've heard raised here about the consequences of survivors who remarry. And that will repeal the ridiculous penalties survivors face when they choose to remarry. But it costs money. And we have to deal with that. It costs money, but we got to do what's right. This bill is not up for discussion here today. And soon we'll have legislation introduced from my colleague, Representative Frank Mervan, to increase benefits for those using Chapter 35 education benefits, but making those individuals, and also making those individuals eligible for the more robust, comprehensive benefits equal to the Forever GI Bill. But I have to say, what is it that is being delivered today by my colleagues on the other side? A bill that does nothing more than fiddle around with VA's organization chart and doesn't do a single thing to improve or expand the delivery of benefits. And I realize there's a controversy over whether the OSA belongs here or there. But I would suggest to you, settling for where it goes is really symbolic, and it doesn't really address the real issues that we need to address in order to get at why survivors continue to suffer needlessly. So I'm afraid, what I see is a fear of taking real action, and that fear is about dealing with the real dollars that need to actually constitute that action. So I would ask you not to just settle for something that fiddles with an organization chart. We have seen historically low levels of legislation to aid our veterans and their survivors pass this Congress. This majority professes to carry the torch for veterans, but they cannot muster the will to move the needle one single bit. So I implore those watching today to not be fooled by window dressing. Instead, demand real concrete action. It's what you deserve, and is what I and my colleagues are fighting for on your behalf. Thank you, and I yield back.
Thank you, Ranking Member. I want to thank our witnesses for joining us here today, especially the witnesses who shared the personal stories and important insights about the challenges that they face after losing their loved ones. Ensuring access to benefits and health care for the loved ones of the men and women who are in uniform is no less important than caring for the men and women who serve. The debt we owe to the men and women who made the ultimate sacrifice extend to their families as well. We must ensure that VA uses the authority and budget Congress has provided to repay the debt to the veterans and their surviving families like yourself. I appreciate the Ranking Member Takano and all his members of this committee who stand with me in our bipartisan effort to do that. It is a bipartisan effort. Maybe he doesn't notice it. But anyway, I ask unanimous consent that all members shall have 5 legislative days in which to revise and extend their remarks and include any extraneous material. Hearing no objections, so ordered. Hearing adjourned.